Social distancing has become crucial to helping slow down the spread of the coronavirus, but for many, keeping physical distance has left us questioning how we can be a caregiver. Helping us navigate how to support our loved ones during this pandemic is psychiatrist Dr. Janet Taylor. Dr. Taylor, thanks so much for being with us. And we know that everyone is feeling isolated, especially those who are sick, whether it's COVID related or not. So how can you be a caregiver in this altered age where you can't physically be next to someone who needs that care?
So caregiving in the age of corona is certainly a challenge, but it doesn't change the essence of caregivers. And that essence is about caring and comfort and managing the support. So use technology to convey how you're feeling and ask if the person you're taking care of what they need. Also, don't be afraid to ask what they need so you don't just assume, and then get help if you need it. But caring for someone is not certainly going to be ever broken by what COVID-19 is doing.
Yeah, everyone needs that emotional support during these times as well. Is there anything that caregivers should avoid doing during this time?
Well, we know caregivers have some of the largest and highest numbers of stress, even pre-COVID-19. So my advice to caregivers certainly is to take care of yourselves, which means practice social distancing, washing your hands, not being around someone if you're sick. Make sure that you go to your own doctor's appointments, and certainly use this time to learn to balance stress, because caregiving is inherently stressful.
Yeah, it certainly is. And Dr. Taylor, I mean, we have just been seeing and hearing these heartbreaking stories about people who are so critically ill, they're in the hospital, and then they can't have any visitors when they're probably at their most physical and emotional vulnerable moment in their lives. So how do you support that person and support their loved ones who have all this fear but can't be there in person to help the patient?
Well, it is devastating when you hear the stories, but you have to trust the process and know, as evidenced by the dedicated people we have on the front line as our healthcare providers, they are taking great care of your loved ones while they're in the hospital. But certainly, if you have an opportunity, maybe you can send in pictures that are in something plastic that can be wiped down. Perhaps you can tape your loved one's favorite songs and ask the nurses or staff to let them listen to it, and write cards and ask the staff to read them to them. So certainly your loved ones know that you care about them tremendously.
Yeah, you can get a little creative in these moments. And worst case scenario, there are many people out there who are truly suffering because their loved ones passed away, and then they can't gather together to mourn their loved one. So what can we do to help ourselves and others in this very unfortunate situation?
Well, first is to acknowledge your pain and grief and give yourself a break in terms of how long that grief can last. I mean, we're losing a lot of things, not in addition to the physical aspect of someone, but jobs, relationships, a lot of things are changing. But know that when someone passes away, one of the best things you can do is establish their significance. And you don't need a funeral to do that. You can light a candle, read a card, think about that person, but do whatever you need to make yourself feel better about the relationship. And know that as time goes on, not giving yourself a limit on time, one day you will feel better.
Yeah, and then just speaking in general terms, we're here really pretty much surrounded with nonstop uncertainty and anxiety. What can be the takeaway from all of this?
Well, the takeaway is that there is positive psychological growth that happens when we either encounter trauma or survive it. And some of those factors are that we have an improved sense of relationships with others. We have more love and kindness. We point to our relationships. And I think people spending time together, most of them are really reestablishing those bonds with their families. We have an openness to what our possibilities are, so we get more creative. We recognize that we have inner strength and we are more spiritual. And lastly, we really pay attention to being mindful and see the beauty and significance of the day-to-day. So there are all those aspects that we can learn if we pay attention and not get so focused on doom, but really look at our own inner purpose and find ways to explore and expand that.
It's so true. It's through tough times that you learn what you're made of, what the people you love are made of. And I have seen so much more love and kindness in the world than I saw before this all started. So we can at least focus on that positive note. Dr. Janet Taylor, thank you so much. We really appreciate your guidance.
Thank you.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.